doing our relaxation flow today, so you're not going to need any more equipment, so we're just focusing on our breath, slow and nice and controlled movements, and just trying to relax so that we're nice and happy for the rest of the day. So come and lie on your backs. Okay, so start with your feet hip distance apart. And then we're just going to think about our connection first of all. So where we should be feeling connected is underneath both our feet, lumbosacral junction, TL junction, both shoulder blades and the back of the head. So we're going to think about our feet first of all. So whereabouts are you feeling that connection? Are you feeling it more on the right foot than the left? Or the left foot than the right? If you are, just try and shift the weight from side to side. We're going to try and get a little bit more balance so that we're feeling it equally between the left and right foot. And then when you feel that equal connection, you're going to think about whereabouts on your foot you're feeling that connection. Is it on the outside of the foot or on the inside of the foot? So if you're feeling it more on the outside, you're going to just try and pull that inner arch down towards the floor without lifting that outer arch. So we're going to keep our knees pointed towards the ceiling and ankles nice and straight. If you're feeling it more on the inside of the foot, you're going to try and pull the outside of the foot down towards the floor. Again, keeping the knees up to the ceiling, ankles straight, so we're not lifting that inner arch off the floor. So once we've got that connection, we're going to make our way to our lumbosacral junction. So we want to start by pulling the spine away from the floor. And should have a nice little arch here. Pelvis is going to tilt anterior into a forward tilt. And then we're going to rock the pelvis backwards, so we're curving the spine into the floor. So that's posterior pelvic tilt. And then just alternate between the two, anterior and posterior tilt, with lumbar extension and lumbar flexion. Backwards and forwards. And then we're just going to pause in the midpoint between the two end ranges. The lower back should be nice and flat on the floor. It doesn't want to be caved in. Shouldn't be an arch underneath your back. And your pelvis should be neutral, lower back should be neutral. And you should be feeling more connection underneath your lumbosacral junction. Then we're going to make our way to the TL junction. Think of your pelvis and your ribcage like the pellet pages of a book. We're going to try and pull the ribcage and pelvis close like the close in the pages of the book, so that they're parallel with each other, so that we can try and come away from this lumbar extension and rib flared position. Pull the pages together, you should be feeling more connection underneath your TL junction. And we'll go to the shoulder blades. Again, they want to be equal connection from side to side, so just shift the weight from side to side until you can feel that connection is more balanced. And the shoulders themselves, they want to be neutral. So we're going to bring the shoulders out of this elevated, anteriorly rotated and protracted position, or internally rotated and protracted position. So we're going to pull the shoulder blades towards the back pockets and try and create external rotation. And then try and bring them towards the floor, but without pinning them down towards the floor. Then we'll go to the head. So the back of the head wants to push straight back down towards the floor. Thinking about activating these muscles at the front of the neck. Don't let the head tilt backwards and don't let it tilt forwards, so it's going straight backwards. Okay, so once we've got our connection, we're going to put one hand on the chest and one hand on the tummy. And we're just going to focus on our breath, thinking about which hand you can feel lifting on the breath in and lowering on the breath out. So we want to feel the hand on the tummy lift on the breath in and lower on the breath out. Shouldn't be any movement coming from the hand on the chest, that wants to stay still. So we're focusing on our breath today, so it's all about relaxation, so we're going to use our breath as a meditation tool to just switch off from the rest of the world. Try not to let any of the worrying thoughts from the previous week come into your head. If you start to feel your mind wandering, you're going to pull your thoughts straight back to your breath every time. Breathe in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. Feel that hand on the tummy lift on the breath in and lower on the breath out. Okay, so once you've got your breath in the right order, put your hands around your waist and we're going to try and create our 360-degree breath. So by this I mean we want to feel that expansion the whole way around the abdominal wall as we breathe in. And then it will relax on the breath out. So the way to try and get these muscles to activate, if you are struggling to find where you should be breathing into, is if you put your hands around your waist and then cough. And it's got to be a big cough because you won't feel them if you do a little cough. Feel all those muscles expand outwards and then use that expansion to just create that connection between your brain and your muscles, so that you know where you're trying to activate when you take your breath in. Do it in stages if you need to, so you're going to focus on the front. So cough again. Feel those front tummy muscles expand. And now think about those muscles pushing your fingers up towards the ceiling. Then when you feel like you've got those, come into the side bits, press your thumbs in, and then cough again. And then think about those muscles pushing the thumbs outwards. And then bring your thumbs into your back muscles, cough again. And then think about those muscles in the back pushing the thumbs down towards the floor on the breath in. It wants to be equal from side to side and from front to back, so try and tie all that expansion in symmetrically, smoothly, in sync, all at the same time. Imagine you've got a balloon inside your abdomen that you're pumping up. So with each breath that you take in, that balloon is going to expand 360 degrees, pushing all those abdominal muscles outwards and getting bigger and bigger with each breath in. Okay, so so once we've got the 360 breath, we're going to think about the brace. So when we're doing things that need more stabilisation, we should naturally be able to brace, but we need to actually think about what to do if you don't know how to do that. So it's not a clench or tense, it's not a sucking in. We're going to breathe 360 degrees. And then before you take your breath out, you're going to do an outward push like you're imagining that you're about to fart, and then try and keep the muscles active as you're breathing out. Do a couple more breaths. Remember to keep thinking about your breath. Don't let your mind wander. Okay, so we're going to start by simultaneously at the same time, we're going to extend our hips out downwards and take the arms out to the side. So I'm going to move a bit away from the mirror because I'm back into it. So extending hips and knees and floating the arms up, but in the abduction movement. So rather than flexion, we're abducting. Keeping that lower back neutral, so try not to let the lumbar spine come off the floor. So we're keeping it neutral. And then bring the arms back down, bring the knees up. Bring the knees up to the chest, grab hold of the knees and breathe. And then we're going to extend the hips and knees again, abducting the shoulders above our head, keeping the ribs down, keeping the neutral spine. And then pull the knees back in, arms down, bring the knees to the chest, grab hold, and then breathe. Feel the muscles in the lower back expand as we breathe in, into the floor, and then lower down, arms up, legs out, and then back down, pull the knees back in. Grab hold of the knees, pull them right up to the chest and breathe. Extend the legs out, so just in your own time, flexion, do an abduction. In your own time, we're going to do that movement a few more times, just pulling the knees up into the chest, bring the arms down, breathe in, legs out, arms up, give a nice stretch to that whole body, but keeping neutral spine if we can, and ribs down. Don't forget the big 360 breath in when you bring your knees up to your chest to get that extra bit of lower back stretch. Just do a couple more of these. Remember to keep breathing in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. Okay, so we're now going to go into our single leg lifts. So lift one leg and lower. Lift the opposite leg and lower. So we're alternating legs at the minute. Keep focusing on your breath. And then we're going to take both our legs up into the air. So we're going to create our 360 breath. Create our brace so that we don't let the pelvis tilt as we're lifting the legs. So lift the legs up into the air, into your 3-month supine. And then lower down. As we're flexing the hips want to go into external rotation and slight abduction. And then as you lower down, they want to come into a neutral position. So your knees are going to be pointed straight up towards the ceiling. And then lift and lower. Controlling what's happening in the pelvis and the spine. So there should be nothing happening there. This is coming from the hips. Do a couple more of these, and then we're going to finish off in the 3-month supine. So 3-month supine, we want the feet higher than the knees, ankles neutral so they're not flopping around, knees over your hips, hips 90 degrees and in external rotation and abduction. So when I say external rotation, your feet will be more towards each other. If they're outwards, your hips will be in internal rotation. So we want them to be more towards each other. And we're holding that position and thinking about our breath, our 360 breath. Trying not to think about anything else that's been going on in the week. If you are struggling with back pain at the minute, you might not be able to hold this position. That's fine. Pop a stool or a chair underneath your feet or a gym ball. We want a nice smooth cylinder in the abdomen, so we don't want those muscles to be shaking. So again, even if your back's not hurting, but you are shaking in the abdomen, put your legs on something, just rest them down. Bring your knees into your chest, give your hip flexors a little rest. And then we're going to go into happy baby or 6-month supine. So we're going to grab hold of the feet if you can. And you want your feet up towards the ceiling. If you need to get a TheraBand, if you've not got the range of movement in your hamstrings, you can hold onto the TheraBand and put it around your feet. And we're just going to hold this position. And breathe. Think about our 360 breath. Breathe in through your nose, out through your mouth. Think about your body position. Make sure that the head isn't tilted backwards, so we're activating those deep neck flexors again. And then what we want to start to do is we're going to just roll from side to side in the happy baby. So we're just going to roll in one direction, try and control it. I'm going to have to stop talking for a second in a minute because you can't roll back without using your core, and you can't do that while you're talking. So you're going to roll from side to side. It might be a little bit harder than usual. If you can't do it with your in happy baby without flopping around too much, you can just go into 5-month rolling from side to side. So just do a few rolls from side to side. I'm going to just stop talking for a second to see if I can do my happy baby rolls, focusing on my breath. So just think about your 360-degree breath and your brace. might find one side easier to get back from than the other. I find it easier to get back from my right than my left for some reason. Just do a couple more, side to side. Okay, and then you're going to roll onto one side, up into a low oblique sit. So legs in the mermaid position, forearm flat on the floor. And we're just going to have one arm on our side, and we're just going to rotate the hips. So we're just rotating round. So we're folding on the hip, and then back. And then fold again. We're just going to, in our own time, just fold in and back out. So we're creating internal rotation in the hip and external rotation. And at the same time, you're going to be folding on the shoulder. So we're folding internal rotation and external rotation. Keeping this shoulder active, try not to let the shoulder push forwards and elevate. So we're activating the shoulder girdle. Again, think about your breathing. So nice, slow and controlled movements. And then you're going to keep that forearm flat on the floor, and you're going to bring the opposite arm round and try and reach above your head. And we're just going to hold that position. And I feel a really nice stretch down the side of my body with my hand that's outstretched. And we're just holding that position and breathe. Couple more breaths, in through the nose, out through the mouth. Feel that muscle and that soft tissue just releasing as you breathe in. Bring that hand back. You're going to bring that back leg forwards in front of the downwards leg. Put both hands on the floor. And then we're just going to lift the bum and then into bear and then rotate round to the opposite direction. Now pull that top leg back again into your mermaid position. Down onto your forearm. And again we're going to do some rotations. So we are folding the hip and folding the shoulder. And back. So externally rotating, internally rotating. Focus on your breathing. Create that 360 breath. Focusing on your body, position of your body as well, making sure that we're not slumping, so the spine's nice and straight, the shoulders active, neck's nice and long. One more. And then we're going to keep that forearm flat on the floor and then reach with the opposite side. Feel that stretch. Nice deep 360 abdominal breaths. Bring your thoughts back to your breathing. Don't let them wander off. Don't think about what you're having for lunch today. Just think about your breathing. Feel those muscles relax as you're breathing. Pull that arm back, and again we're going to take that back leg forwards, so the foot's in front of the downwards leg. Put both hands on the floor, and we're going to lift again into bear, so twisting round into bear, and then back to the opposite side. So we're double hand high oblique sit, twisting into bear, and then to the opposite side. Nice, slow and controlled movements. Making sure that the shoulders and pelvis want to move at the same time. But obviously with this, because we're keeping that both hands on the floor, you will feel like a twist in the spine. So a nice stretch, but make sure it is nice and controlled. So just do this in your own time. Nice and controlled movement. Just do one more each side before we're going to go into there, and then down into quadruped. So what we're going to do now, I'll just show you first. So we're going to hinge backwards in quadruped. We're going to bend the elbows, pull ourselves forwards into a bit of a cobra, but I don't want you to have your hips right down to the floor because we want to keep that neutral spine, so we're not extending through the upper back and through the lower back. And then we're going to go into a cat, so we're going to round the upper back and then come back, so flatten off into your quadruped hinge and then through again into cobra. So we'll do it together. So get in neutral. Start off, we're going to hinge backwards. So hinge in the hips. And then you're going to bend your elbows and then pull yourself through into a cobra. Yeah, so extending the hips, keeping neutral spine, and then round off into a cat. So round the upper back, so round, so tuck the pelvis under, and then as you're coming back, start to flatten off your upper back, go into your neutral pelvis, hinge backwards. And then go again, so flexing the elbows, into cobra. Just be careful not to extend the lower back, so keep in neutral spine. round the upper back into cat. And then as we're coming back, we're going to flatten off, hinge backwards, and then come forwards. So we're just going to do this a few times, just in your own time. So hinge back, yep. And then forwards into the cobra. Not too yet, and then round the upper back, so round, 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 round. And then flatten off as you're hinging backwards, so you're coming back and flattening the upper back, hinge back. And then forward, so just do a couple more of these, so flexing the elbows. And then round the upper back. And then flatten off as you're coming back into the hinge. We'll do one more. Pull that back forwards into the cobra. And with this cobra, there shouldn't be any lower back pain. You shouldn't be extending the lower back at all. So, round the upper back into your cat. And then flatten off. And then we're going to be in this quadruped hinge. We're just going to hold this position for a second or two and focus on our breath. So 360 breath. And then you're going to take your elbows to the floor and just pull yourself forwards. So we're going over the hands and then back. And then lift. Yeah, so straighten your elbows. And then lower your elbows. And then pull forwards. And then extend the elbows and fully extend the elbows. So you want to come down, so you're in this deep quadruped hinge. You're going to flex the elbows, extend the elbows back to your quadruped hinge. Then, sorry, not quadruped, you'll be in your deep low quadruped. And then you're going to go up into your quadruped hinge. And then down, forwards, back, up, down, forwards, back, up. Keep breathing, focusing on your breath. Keep the neck, the deep neck flexors active, so try not to let the neck go into extension. Do last one. And then back into your quadruped. Okay. So now we're going to go up into a bear and just do some quadruped to bear to quadruped to bear. So find your neutral spine, upper back nice and long. So we're not rounding through here, so pulling the upper back down towards the floor, curl the feet under and lift and lower. Lift and lower. Push the floor away with the hands. So we're working on that shoulder stability. Just do a couple more of these. And then from the bear, we want to push the legs straight and we're going into downward dog. Feel that stretch down the back of the legs. Try and lengthen and flatten through the upper back. Folding at the hip. Focus on your breath. Try and make sure that your ankles are in a neutral position so they're not bent and rolled over. And then we're going to pull one leg forwards into our pigeon. So from here, bring one knee and hip into flexion and pull it into pigeon. And we're just going to hold that position. And breathe. Keep the shoulders active, try not to let them fall into an elevated position. Curl the back foot under, lift the legs off the floor and back into downward dog. And then you're going to take the opposite leg forwards. And breathe. Pull your mind to your breath. Hold this position. Feel that stretch in that bum cheek. Curl the back foot under and then bring yourself back into your downward dog and hold. And then down into your bear. And we're just going to hinge the hips backwards now. So, into a high bear. Walking the hands back into your squat. Nice and long through the upper back. And stand up out of that position. And we're just going to work on our air squat now, making sure we've got our neutral spine. So, find your neutral, walk your pelvis backwards and forwards. Take a 360 breath in and then slowly lower down. Trying to think about what's happening in your pelvis and your lower back and your upper back. And then come out of it. And down. So just in your own time, up and down, really visualising what's happening in that pelvis and lower back. If you can feel like little micro movements, just readjust into the right position and think about weight transfer as well. Think about where your weight is going to. Try and get balance between right and left foot so that you go straight down. Just do a couple more. Control the pelvis, control the lower back. And then we're going to go down, walk the hands out into there, and take one leg forwards into tripod. So this is another little sequence we're going to do. So we're going to, I'll show you, tripod rotation, up to the sky, hand down, into high kneel, opposite high kneel, hands down into tripod, tripod rotation, hands down, high kneel, opposite high kneel, tripod, okay? So, let's do it together. So, tripod rotation, hand down into tripod again, try and lengthen through the upper back, and now we're going to come into high kneel, keeping that pelvis neutral, come round to the opposite high kneel, hands down into tripod, tripod rotation. Okay, so now you've got it, just go ahead and do it in your own time, or you can keep following me. So focusing on your breath as well, don't forget your breath. Focusing on your pelvic position as you're coming up out of that tripod into high kneel and lowering down, so we're hinging at the hip. Make sure when you're in your tripod, you are nice and long through the upper back, so we're not rounding through here, so we're trying to pull that upper back down towards the floor. Just do a couple more of these. And then the next bit is we are going to do a similar thing, but we're going to stand from the high kneel. So we're going to make sure we've got the pelvis level, make sure we're not too narrow with the foot, so the foot's out to the side. Pelvis level with the floor, neutral lower back. As we stand, knee track the second and third toe. As we take the leg back, reset, make sure the pelvis is level with the floor as we're lowering down, so lower down for 3 seconds, and then you're going to lift and twist the opposite direction. And again, make sure the pelvis is neutral, level with the floor, neutral spine, and stand. Leg back, slowly lower down, and then opposite high kneel. So we're going to twist round to the opposite high kneel. And we're just going to do this from side to side, so in your own time now, nice and slow. Get your balance, get your pelvic position. Focus on your breath. So 360 breath. You'll be able to control this much better by incorporating the 360 breath into it. Focus on your position. We want to make sure the pelvis doesn't jut out to the side as we are standing and as we are lowering, so it's really slow and controlled. Let's do a couple more. Keep breathing. It's nearly there. Try not to think about anything else other than your movement and your breath. Last one. And we're done. Right. Hope you enjoyed that, guys. When you do it, have a great day.